Hi everyone, it's Joe and welcome back to another lecture. We're in the middle of talking about geometric factors. This is lecture 1.3 for module 4 in RAD103. So we're wrapping up the semester pretty soon. And we're starting off by talking about irregular anatomy. Now the body is filled with a whole bunch of irregular shapes to it. We just talked about the scapula. All of the vertebrae have a strange shape to that. Not every bone is, going to be like a radius or an ulna. There are bones with different shapes to them. And when we're considering geometric distortion or geometric factors, if we could try to keep that type of anatomy in the central beam, in the central ray, you're not going to have as much distortion to the shape. But if you start pushing those irregular shapes towards the outside, you're going to cause some elongation, and the actual image may be a little bit distorted. Now, I have to admit, through my experience of working as a tech, have I really noticed this? Not really. So I think that this is more of a theory. I suppose we could play with some x-ray and try to make some of these irregular shapes look bizarre on the x-ray, but I've never really seen that in practice, and I've never seen an image come out with irregular anatomy on the edge of the plate that looks skewed or different. So it's kind of a theory to keep in the back of your mind in case you get a test question about it. But in general, the stuff that we're interested in is usually in the middle of the plate anyway, or the middle of the central ray. So you don't see that much geometric distortion from that stuff. All right, and we're on to the last geometric factor. When we started this whole lecture series, we mentioned that when we're talking about geometric factors, we're talking about magnification, distortion, and then focal spot blur. You need to remember those three things, okay? So here we are on the last one, focal spot blur. Now we get focal spot blur usually on the edges of an image, and if there's any fuzziness to it, we call that penumbra. And I can quickly show you this if you're in class. I probably showed the example of me just using the flashlight on my phone and creating a shadow, and as I had more and more OID, you could start to see the image become a little more fuzzy rather than a clear, distinct shape of the shadow of my hand. That fuzziness is called penumbra, and that often is a result of the anode heel, because we deal with an anode that has an area to it rather than a defined little tiny spot of X-ray coming out. And so I'm going to try to explain that with this slide here. So let's start by looking at this top image. You can see this top blue line is the focal spot. So again, it's not a spot, but that's the area of where X-ray is going to come out. So that's kind of like the width of the focal track on your anode. And again, if you played with the geometry and you started drawing lines from one edge of the anode to the edge of the image plate and did the same on the other side, and then also did the same for the same side, you would see you've got these crisscrossing lines. This area where you have crisscrossing lines is where you're not going to get a sharp image. You're going to have blur or penumbra. And so there's different things that can affect that. The first thing that can affect it, which is shown in this top image, is that if you have higher OID, you're going to have more penumbra. So the farther I take my object away from the image plate, the more penumbra or image spot, focal spot blur I'm going to get. This example you can see here, the object is closer to the plate, and therefore I have smaller amounts of blurring or penumbra. So if I can keep my OID to a minimum, I'm not going to have as much focal spot blur. The other thing that can affect that is your SID. So on this bottom picture, you can see we've got the focal spot a little closer to the plate. The subject or the object that we're X-raying is all of the same distance, but this is closer. And don't forget, when we bring our X-ray tube in closer, the angle that the light has to use in order to reach the entire plate is a lot wider. It's a lot steeper, or a lot more dramatic, I should say. And so here we've got a closer SID. So the lower the SID, we've got a lot more penumbra. This subject, or this object, I don't know why they call it a subject, but let's say the object here. It's in the same spot, but I've pulled my X-ray tube back. So now the angle to reach the plate isn't quite as dramatic, and so therefore I get a little bit less penumbra. So if I could bring back my SID or increase my SID, I'm going to get less blurring. And so that is, it works the same way as trying to minimize your magnification. In other words, if you're trying to minimize any focal spot blur, have the least amount of OID and have the longest SID that you can use. And that's the exact same thing you need to remember when you're trying to deal with magnification. To lessen any magnification, use the lowest amount of OID and the highest amount of SID, and you'll have less magnification. So try to remember that focal spot blur and magnification work the same way. This is another picture for focal spot blur, but what I like about it is that it's telling you that you're going to have more blurring on the cathode side than you are on the anode side. Why? Because that anode heel gets in the way, folks. Always does. So because we're not dealing with just a spot, and actually that's what was on the last slide, by the way. Let me see if I can bring it back to that. So here's a focal spot. If we had X-ray come out of just one tiny spot, we'd get no blurring. But because the anode that we're shooting at has, there's a width to it, there's an area to it, we're going to get that blurring. But if X-ray just came out of one little tiny spot, we wouldn't have this problem, but that's not the case. So when we're dealing with any type of focal spot blur, you're going to have more blurring on the cathode side than you are on the anode side. Good to remember. And it's also, it kind of coincides with that whole anode heel effect, where you're going to get a stronger X-ray beam on the cathode side and not as energetic on the anode side, but you're also going to get more blurring on that cathode side. So try to remember that. And again, I know I've already talked about this, but to lessen any type of focal spot blur, use or decrease your OID, increase your SID. It's just like magnification. If you can remember one, you can remember both, and you should be all set. Now, I must admit, have I ever taken an X-ray and looked at it and said, oh my God, I've got way too much blur on this image? No, as a matter of fact, I almost never see penumbra. I almost never see blurring. But it is a test question. You just simply need to know that geometric factors include magnification, distortion, or shape distortion, and focal spot blur. Focal spot blur is something we'll always have to deal with because of the shape of the anode. But do I ever see it? I've never seen it. So it's hard for me to really hard to give you examples of it because I've never really seen it in practice. But you should know it for the test. All right, and this leads us to subject factors. So we're kind of putting aside geometric factors, the whole magnification, distortion, focal spot blur. We've talked about how the body part oriented to the plate, oriented to the X-ray beam, can change its shape or its size. But now we need to talk about the actual patient themselves, what it is that we're X-raying. What are we putting in between the X-ray tube and the X-ray plate? And this is stuff that the patients are made up of. And so this affects the image quality that we get. And so that's why we need to pay attention and learn more about subject factors. Not only do we need to be aware of a patient's size, because we know that if a person's bigger or smaller, we either need to increase our technique or decrease our technique. We've already kind of mentioned how the shape of a person could affect the image quality, but again, there's no body part that's going to fit perfectly within an X-ray beam's, angulation. But there's also the tissue composition. What is it that we're X-raying, and how does that affect the overall quality of the image? We already know that certain body parts are going to require more or less technique. But have you ever think about, is the person filled with muscle or are they filled with fat? Does that composition have anything to do with the technique? And it does. So let's take a look at that. The 4 subject contrast factors are patient thickness, tissue mass density, the effective atomic number, and then, of course, the object's shape. So let's start by defining what subject contrast is. And subject contrast is the contrast that you see on the radiograph that is affected by the patient's size, shape, and tissue composition. The next habitus to discuss is hyposthenic. Hyposthenic people are healthy, but they're thinner. They've just got that string bean look. They're pretty thin. They might have muscle tone, but not as muscular or as bulky as someone who might be considered sthenic. So hyposthenic people make up about 35% of the patient population. I would still consider probably a normal regular technique for hyposthenic people. I guess if they're smaller in stature, I might go down a little bit, but I would still consider them probably of a normal range. But their build is, like I said, that thin look. People who might be runners or people who are, tall, lanky basketball players type of thing, they might be considered hyposthenic rather than sthenic. So that's hyposthenic. All right, the next body habitus is hypersthenic. Hypersthenic are bigger people. They're usually stockier, bigger, considered probably overweight. These big people generally have a chest with a very small lung field, whereas hyposthenic usually has a very elongated lung field. So just remember that when you're doing these types of, when you're doing a chest x-ray. Hypersthenic makes up about 5% of the population. And these are the types of people where you probably have to go up in technique. So whether you go to the big man setting on the AEC or increase your density, whichever you prefer, or of course just going up in your technique at all. So, so that is hypersthenic. And then there's asthenic. So asthenic people are very small, very frail, usually associated with an elderly person who's just losing that muscle tone. They're losing, that muscle tone that they've had in the past, and so they seem very, very thin and frail. So those people make up about 10% of the population. With an asthenic person, I would certainly recommend going down in technique or minimizing the AEC exposure. So just remember, asthenic people, those small, frail, emaciated people, usually elderly, 10% of the population. Good to know. So you should be aware of all of these body habituses. And lastly, just to wrap things up for this video, is that with body habitus or body thickness, we measure patient thickness by using calipers. Now, I know that these are probably never used at clinical anymore, but it is a basic registry test question. You should be aware of what this device is. This is a caliper, or if it asks you, how do we measure or what do we use to measure a patient's thickness, we simply use calipers. So understanding what a caliper is, I've got them in the classroom, so if you want to go check them out, but just be aware of what calipers are. And I think I'm going to wrap this video up right here. So when we come back, we're going to be talking more about subject factors and talking more about body composition and whatnot and how it affects x-ray quality. So I'll see you all at the next video.